right now here to talk about the pause on Johnson & Johnson, as well as Kern County being one step closer to normalcy, is Public Health Director Bryn Kerrigan. Thank you so much for being here, Bryn. And I'm going to jump right in and ask you, why did it take us so long to get to this orange level?
I'm actually really thrilled with the speed at which we've moved from the red to the orange. Within 4 weeks is fantastic. It took us a little while to get to the red. We had to get control of the transmission of the illness once we hit our surge back in January. But I think it had a lot to do with getting our community vaccinated. We're seeing increased vaccination rates. We're seeing people practicing those mitigation measures to prevent the spread. And so I'm thrilled that today we're in the orange tier.
And we're already kind of starting to talk about, moving into the yellow. Is there a chance, though, that we could, go back at some point to red?
There's always a chance to backslide. So it's important that we continue to practice those mitigation measures and that we all do our part and get vaccinated so that the transmission doesn't increase. We are so deep into the orange already that we are so close to the yellow. I am optimistic that we'll be in the yellow shortly.
Now, I know throughout the pandemic, typically we've seen spikes, following holidays and whatnot. Have we seen a spike related to Easter, or would that not, be evident, for another week at least or so?
Yeah, the gatherings from Easter, we would have started to see some increases in our cases. We typically start to see them about 3, 4, 5 days following people starting to gather, up to 14 days starting. So we're within that time period that we would start to see increases. However, we have not seen an increase in our cases coming in each day.
Okay, so that's really positive. And let's switch gears and talk a little bit about the vaccine. Obviously, Johnson & Johnson, the vaccine being put on pause. We've heard from officials, Governor Gavin Newsom saying that the amount of Johnson & Johnson vaccine being given out in California is relatively low. What's the impact here on Kern County, if any?
There is very little impact. Out of our 25 to 30,000 doses that we receive each week here in Kern County, about 3,000 of those are Johnson & Johnson. Now, we do use that Johnson & Johnson vaccine to target those that are at high risk or, high risk of not returning for that second dose. So we have to sort of switch gears and figure out a different way to get to those high risk community members that may not come back for their second dose. But as far as the volume of vaccine that we receive here in Kern, it has little impact.
Yeah, and obviously the past few weeks we've been seeing more people come up from LA County to get their shots here. I understand that has slowed down. Are you expecting that trend to continue as other areas open up?
I truly hope that trend does taper off, because the vaccine that we receive here in Kern County is intended to be used on Kern County residents.
And is there any hesitancy among residents here to get that vaccine? And if so, why do you think that is?
So there has been some hesitancy. We have seen increases in the volume of vaccine that we've been administering each week, so that's great. We have had some, conversations with community members that are a little bit afraid because of not understanding, a lot about the vaccines. So we've tried to implement different tactics so that we can provide that information to them. We've been canvassing, we've been launching vaccine information booths with nurses that can answer questions for our community. And we've seen once that we've had those conversations and answered those questions, that they have signed up for a vaccination appointment. So it's just sort of answering those questions and calming their fears, and then they're ready to get vaccinated.
And is there any concern with supply, as Johnson & Johnson has been temporarily put on hold? Is there still enough Pfizer vaccine here in Kern County?
Yeah, we feel like we have a sufficient supply. That Johnson & Johnson doesn't impact our supply too much. Of course, we'd like more. We want to get our community vaccinated as quickly as possible so we can move to some sort of normalcy. But there continues to be available appointments. So it's just getting our community to get vaccinated and hoping that increased supply comes our way shortly.
Bryn Kerrigan, thank you so much for taking the time to speak with us this morning. I appreciate it.
Thank you.